There seems to be a wide variety of opinions.
Hey, what you got there?
It's not a policy! It's not policy! It's not policy! It's not policy! It's not policy!
It'd just be nice to know that we could get the word out that this is not manufactured, that the people really are against the health care. We're not here because the insurance lobbies paid us or the RNC. We took time off of work. We used our own gas, our own car. This is important. The health care bill does more than health care. It changes the landscape of government intrusion into our lives beyond what we all have ever seen before. And that's why we're against this bill. We're not against reform. Reform does need to happen, but not a government takeover of health care. I mean, we had a doctor today at Patients Rally that spoke, and I asked her, why don't doctors speak out? And she said because they're afraid of the backlash. So, you know, what does that tell you? I mean, we need to get the word out.
Not everybody's Oh, good. Yeah, that would be good too. Because we don't know who else is going, so it's we'll need to have some further bases. Thank you. We'll save some of those in.
Thanks for coming out, Jared. It's going okay. Good.
Oh yeah, this is the spot.
I know, Mom.
We're gonna get
We got the tax liens on the Mustang Ranch. For a while there, the government owned the property.
End of life is at the hands of the government. Page 427, line 22 to 25. Government will guide you to a nice death. The government will tell you how your life will end. Page 429, lines 10 to 12. Another order
Yeah,